Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. NIK NIKAM. I'm from Houston, Texas. In this presentation, we're going to talk about semaglutides. Semaglutides have been extremely popular among patients with diabetes, and especially for patients who are trying to lose weight. And this has shown exceedingly promising results in terms of diabetes control, weight loss, reduction of cardiovascular risk factors, and all those patients who have taken these semaglutides, which is an injection taken once a week. And the important thing we need to keep in mind is what happens when you take a semaglutide. What kind of changes do you see? And what happens if you were to stop taking semaglutide? If these changes that you see are related to the medication and you have to be taking it lifelong, or is it something that you can take for a short period and then you maintain certain levels of weight and reduction in risk factors, and then after that you can continue to discontinue? Is it possible for you to discontinue? We're going to look at all these different things. Okay, here are some of the important factors about what happens when people take diabetes medicine, the semaglutides. That's an injection that's taken periodically. And what kind of changes do we expect to see? What happens if they stop? And how long will it take for the things to change? So to address this question, a study was published in the PubMed, internationally recognized medical journal, where they looked at 327 patients who were on semaglutides, and after they stopped the semaglutide, they followed them for up to 68 weeks to see what kind of changes they expected to see. Okay, those people who are on semaglutide lost an average of 17.3% weight. Their blood pressure came down. Their hemoglobin A1C, which is a barometer of diabetes control, was down. However, and their cholesterol and cardiovascular risk factors were reduced. However, when they stopped the medication, a lot of these things reverse back too. People gained weight. Their blood pressure went up. Their hemoglobin A1C went up. And we look at from this study as, how much did it go up? And here's a study showing in the first, I don't know if you can follow my arrow. In the first graph here, we have during the treatment period, the weight came down dramatically, 15-16%. But after they stopped it, over a 120 weeks period, they gained weight. Almost majority of the weight they gained. And similar results were found with systolic blood pressure, which had come down from like 130 to 115, and actually it rebounded and went higher than what it was before. Same thing with diastolic blood pressure. C-reactive protein, which is an indication of chronic inflammation, which is commonly seen in diabetic patients. It had dramatically decreased during the semaglutide treatment. However, it started to creep up after they stopped the semaglutide treatment. Hemoglobin A1C, which I talked to you about, the barometer for diabetes control, which came down from 5.7 or 5.8 all the way down to 5.1, and when they stopped taking semaglutide, it gradually started to go up. And if they continue to not take the medication, these numbers may almost reach the levels that these people had before treatment was started. I mean, we don't know that. At least based on this study, we know that majority of the risk factor reductions sort of were reverting back towards the baseline after stopping the semaglutide. No question, those patients with diabetes and those who are concerned about weight, they want to maintain their weight reduction and risk factor reduction lifelong. Does that mean they have to be taking these medications lifelong? Of course, semaglutides have been FDA approved, and we have a lot of patients who are taking blood pressure medications, heart medications, and diabetes medicines lifelong. So we see no issue with those. So the final point here is that when you are taking semaglutides, you see a significant positive results, and if you were to stop taking semaglutides, then your results will be less than favorable, and a lot of the benefit you had received by taking semaglutide may gradually vanish over a period of time. This is Dr. NIK NIKAM. I'm talking about semaglutides for management of diabetes mellitus, weight control, blood pressure control, and also for diabetes control, which does a wonderful job. But what happens when you stop it? And here's a study showing that a lot of these things will revert back towards the baseline. We'll see you in the next presentation.